The team has grown, and right now at the Heart Institute, people who have finished that formal training, at doctor level, we are about 22. Now, when in the pipeline are those ones who are about to finish that, who are training the examples of him, and in all these disciplines. So we have those ones in adult cardiology, we have those ones in pediatric cardiology, we have those ones in surgery. In fact, as we talk even there, we have 3 people abroad trying to beef onto that one.
For the very first time, the Uganda Heart Institute has attained the technical capacity to offer the complete range of cardiac care services for both children and adults, including the coronary bypass surgery.
So this competence at that international level is both for children and adults, comprising of diagnostic services, non-invasive care in the intensive care units and the critical care units, invasive and cardiac catheterization interventions, and finally the open heart surgery program, and mark you for both children and adults. The coronary bypass surgery was the missing link, which we have now achieved, and we are celebrating with the rest of the nation this achievement.
The executive director of the Uganda Heart Institute, Dr. John Omagino, however, says that the institute is currently facing a huge backlog of over 500 patients due to inadequate funding, and therefore calls for at least $65 million to meet the demands.
Now the other capacity is left, not because of any other reason, but the supplies, the items we need, and those is funds. This team here is ready to do everything, but there are those limitations, and the other limitation as of now is space. Is what? Space. You go down there, we only have 4 ICU beds, and even if we wanted to do a lot, every patient who is leaving the operating theater needs an ICU care for 24 to 48 hours before they go to the general ward. So this is the rate limiting block.
Dr. Omagino says with adequate funding, the Uganda Heart Institute will aid generate foreign currency, hence national development.
The unit cost for a comprehensive care, that includes the diagnostic side, the interventions in the cath lab, and the operating theater, and the subsequent care in the intensive care and the coronary care units, and any other rehabilitation. That is the unit cost. By the time you pass the patient through the whole cycle, it costs between $5,000 to $8,000 US. Now, one may say, hey, that is a very expensive cost. But this cost, when compared to referring patients abroad, which on the average costs US dollars $20,000 to $30,000, the 5,000 is a very low and highly subsidized. At least it is a quarter of what you would spend when you send the patients abroad. But besides, when we operate these patients here at home, there are various benefits of capacity building, of teaching, of training, of supporting research, of saving foreign currency, of treating patients in our native environment. That culture clash is avoided. It also builds our national pride.
Justine Nabunya and Godwin Kaizi reporting for Record News.